So the idea for Nursing Education Day really came from speaking to the other educators, the nurse educators from across PMCC. We were hearing from the nurses that there was such a need to educate nurses in ACHD. It is a very unique sort of patient population, and sometimes can be challenging, especially if you are not looking after these patients all the time. They have very complex needs. So it's to better prepare our nurses, to educate them, to be able to look after these patients, with us, and for them to be more comfortable with this patient population.
This population, they have a complex cardiac anatomy, they have long cardiac histories as well as surgical history, so that's a challenge. The second one is psychosocial needs that they have. I feel that we are there to identify or to share with them their illness experience, and that their challenge is behavioral. We need to pay attention to their health behavior, their knowledge, because they need to learn how to manage their disease to some extent.
We manage these complex patients by a very comprehensive team approach. So this requires our physician colleagues, this requires the occupational therapist, the physiotherapist, dietitian, speech-language pathology, pharmacy. It requires all team members to look after these complex patients. And it's not one individual practitioner looking after these patients. It requires input from all individuals to best manage these patients. Not only their unique congenital defects that they have in the anatomy, physiology, but also to maybe understand a little bit more of the challenges that these patients face on a daily basis. These are patients that have lived their whole life with congenital heart disease, which is can be somewhat different than if you have acquired heart disease. So many of these patients are young. Many of them have been in and out of hospital their entire lives, and have frequent hospital visits, outpatient visits.
In my opinion, providing this education day to the nurses is going to be very beneficial for them. The hope is that this is going to better prepare them to identify the specific needs of this patient population, and also better prepare them to provide some counseling and educate the patients and families.